everyone. I'm Lori Sherer, and I'm delighted to be doing the Meet the Speaker event here with Gina Papush, the Global Head of Data and Analytics for Cigna and Evernorth. Gina, thank you so much for your tech talk. That was terrific. We really enjoyed hearing about how your team responded to COVID and the whole suite of COVID analytics that you have created.
Thank you,
Can you hear
Lori.
me?
It's yes.
Okay, great. I have a little bit of a delay here on this side. Listen, I was with you the week, I think it was right after WiDS. We had dinner in Connecticut, and I remember talking about, the early signs we were seeing and the things your chief medical officer was saying. And nobody, of course, at that point in time had any idea how, widespread and the duration of this pandemic that we're in right now. I'm really interested, and I think our audience would be interested to hear, how did you initially respond? So as this started to unfold, and in your role as the head of data and analytics for a company that serves 170 million customers worldwide, what were the questions your leadership was asking you? And how did you have to then pivot and mobilize your team and experts and so on and so forth to support the insights required to try to manage through all of this uncertainty?
Thinking back, it's been almost a year since things started, Lori, and we work for a healthcare company, and the first priority was about our people. So we shifted very rapidly, as almost everyone did, to working from home last March. And the pandemic put a ton of pressure on people in different ways. Everyone is impacted. Some are impacted directly, others have kids at home, others take care of family members and are caregivers themselves. And before anything else, I feel I owe a huge thank you to our team. They really didn't miss a beat, and they took on a number of new challenges related to COVID in their day-to-day work, while keeping everything running very smoothly. We had a lot of questions. I covered a little bit of the data challenges at the Tech Talk. The first and foremost challenge was figuring out who is diagnosed and understanding how to accurately identify those that are diagnosed, and how to create an outreach that provides the help that they need. And across Cigna and Evernorth, there had been a very rapid mobilization. We created a command center that was led by two members of our enterprise leadership team. And the command center started pulling those efforts together. For us in data and analytics, there were a lot of questions related to what are the expected levels of infections and hospitalizations. For those who get hospitalized, what level of outreach do we need to create, especially those that may have severe or even moderate cases? What kind of tools and information can we provide to those who are looking for information? Our digital team did a lot of work in that space. And from a data analytics standpoint, the questions evolved from knowing what's happening and kind of being able to report on that in near real time, to starting to think ahead and anticipate what happens next, how we need to plan operationally for the increase in infections and hospitalizations, what needs to happen in terms of different aspects of support that we have to provide. So our analytics work evolved as the pandemic went on. New data came in, and a lot of new tools were created as we worked through it. The biggest and most challenging thing has been to keep up with the data, and a lot of our machine learning tools as well as analysis have been developed and redeveloped multiple times as new data comes in. So we're continuously and still working in a rapid cycle fashion.
Quite a lot of challenges thrown at you. And I know you first were working on the EPI models, but then quickly pivoted into like practical applications. So I know, for example, your team supported targeted outreach to certain vulnerable populations. Can you talk a little bit about that? Like, analytics in action and how you actually used analytics to actually make a difference in the patients' lives, members' lives.
Yeah, and for us, it's been a very much a day-to-day process. We gather as a team weekly to go through the new developments, new insights that our data unlocks. Ability to create proactive outreach, to your point, has been tremendous. And this is all done by amazing people who work in our clinical care team, folks who work in our customer engagement and our digital and marketing teams. And the breadth of outreach has been quite tremendous. Our pharmacists who are on the front lines every day, and the number of people in our call centers who are taking calls and trying to make sure they get the help that the customers need. They all have different needs in terms of analytics. For example, in the call centers, they need to know how to staff up or down depending on the call volume. And with COVID and other non-COVID related changes in how healthcare is being utilized, they have been impacted quite a bit. So they've had a very dynamic year, and we've been able to help them with the intelligence that identifies when they need to staff up, or when they need to adjust some of their processes related to that. We had also found that as the pandemic evolved, there have been changes in how people who are hospitalized are going through the process. Initially, when you were being hospitalized, you had to go through a pre-authorization process. That was true for most insurance companies. As the pandemic evolved, most of our peers, and we were the first ones on many of these actions, actually waived the requirements for pre-approval. That strangely eliminated an important data source for us, because we no longer knew that somebody was being admitted to the hospital with COVID in real time. So we had to work around and find different ways to identify those who are being hospitalized without creating a long data lag. And throughout all of these are practical decisions that we have to make, where we need to direct people who are providing the support, how we need to create the outreach. And in a number of communities that we serve, there has been a lot of health disparities, and we are creating continuous outreach, leveraging what we call our SAFE campaign, where we are sending out care kits. We're partnering with employers in those markets. We're partnering with community leaders, and it's been a tremendous partnership across our team, our clinical team, our employer team, and our marketing team, to make sure it all comes together and we do meaningful things that put care kits and flu shots in the community.
That's amazing. And I know, because I've known you for quite some time, and I know your background, that this is not the first crisis that you've led analytics through. You spent time as the head of analytics, data and analytics at Citibank's mortgage division, and had the fortune or misfortune, whichever way you put it, of leading that team through the consumer credit crisis. So I'm wondering if you could just, for our audience, talk about, sort of the role of corporate analytic leaders, the societal responsibilities that you have and that you feel as an individual, and how that crisis and managing through that crisis compares and contrasts potentially.
It's an interesting question, and I feel we are uniquely positioned in the data and analytics field to actually bring information to bear that creates the right societal actions. I do think I have been more fortunate than disfortunate to live through this twice in my professional life, and to be able to contribute to how we solve for the needs of our customers and for the needs of our society. During the financial crisis, our first priority, being in the mortgage business, was actually to keep people in their homes. We had so many people who were unable to pay for their homes and that needed financial help. And so we've pivoted all of our analytics work and all the predictive capabilities and behavioral analytics that we had at our disposal to identify customers who could no longer afford their mortgage payments. And we've created targeted outreach efforts that would help them in various ways. We were one of the first companies that introduced the mortgage payment deferrals for those who lost their jobs. We piloted the program that was later adopted and extended by the US government. We also created a lot of outreach that offered proactively modifications and refinances that lowered mortgage payments. And there were a number of other things we did. So we put the analytics intel and our ability to make sure we can reach the right customers with the right information that's relevant to them to work during those crisis years. And today, we're living through the pandemic, and I am working with an absolutely amazing leadership team at Cigna at Evernorth. They are incredible health professionals. They care deeply about making our healthcare better and helping people get through the pandemic. As our CEO, David Cordani, says, and it resonates with me tremendously, he always talks about all the things that we've put out for our customers, eliminating co-pays, eliminating other out-of-pocket costs. And this is all very important because our first priority for our customers is to get better. And the analytics that we do, we believe the intelligence actually helps us serve the customers more effectively, partner with hospitals, partner with physicians more effectively, and start preparing already for what comes post-pandemic. We have quite a lot of new analysis that tells us what health risks we can start anticipating as we come out of this pandemic. Some of these are related to those who are being termed COVID long haulers. They have symptoms that persist and health issues that emerge post-COVID. Others are related to folks who didn't even have COVID. It has to do with people who've deferred their care. And there are effects of deferring care, especially for people with chronic health conditions. So we're very actively already working towards what needs to happen next and how we create new types of outreach to get people back for their necessary care, even while we're still working through vaccinations.
That's terrific. It's a pretty heavy duty to society and to your members, and a great use of analytics, I guess, to try to take care of people. We have a question from the audience here. A question has to do with whether or not you use social determinants of health in your analysis. And so I know you've touched a little bit on some of the outreach, but perhaps you could talk a little bit about how COVID has impacted certain populations more or less, and what you're doing about it.
It's a great question. We as a company, on a whole, really focus on health disparities and health inequities because it's a real issue. And we have a whole organization and a health equity council that works on these across the different communities that we serve. Specifically within our work in data and analytics, we've created our own social determinant index. It's been created by our clinical analytics team, and it's been in existence for quite some time. And as our work on COVID unfolded, the clinical analytics team brought the breadth of the work that they've done in this space into our analyses. And one of the things that we found, not surprisingly, because we see studies on this across the board, is we do observe significant disparities in health equity issues related to COVID. We can very specifically identify and quantify those based on our data, and we can narrow these down to specific geographies and communities quite precisely. And in our analysis, what we're finding is that we have significantly higher diagnoses and hospitalizations for Black and Hispanic customers. Additionally, they do have higher rates of chronic conditions, and this increases their complications. And on top of it, unfortunately, they are often less likely to seek care, even when care is accessible. So when all of that is brought together, what you have is a very disproportionate set of health equities that results in these communities with respect to COVID. So we have put quite a lot of effort in this as a company as a whole and as a data analytics team to make sure that we get zeroed in on the geographic areas where these inequities exist. We partner in these geographies with local communities and with employers to make sure that we drive proactive outreach through both of those partners. We also have done with our marketing team tremendous amount of work in distributing care kits. They include masks, they include sanitizers, they include other thermometers and other items. We've put our mobile clinical buses on the road to distribute the PPEs to make sure that we provide flu vaccinations. And now we're gearing up for vaccine distribution in these communities as well. It's data driven. We leverage a lot of individual level health risks as well in how we structure the outreach. And it's very gratifying to see that this work brings it together and absolutely brings together the social determinants component into it.
That's terrific. We have another question from the audience, probably a good segue from that one, which is just talking about the culture of your analytics team and the culture, in the environment in which you're working. And how do you manage a team, and what kind of culture you're trying to create within your analytics team that allows you actually to be nimble and responsive, given this thing is unfolding and it's changing every single day?
It's a great question. This has put us to a test. We have a fantastic team. It's a large team, and we are geographically distributed. We have people who worked remotely before COVID, and now we've all gone to remote. So for us, the challenge has been in how do you bring people together to solve problems effectively in this environment, and it's been tremendous. What works for us is creating small teams that tackle problems and making sure that we bring people together on a regular basis to share the findings and make sure that we are deploying them in different areas so we create the cross leverage. For example, I talked this morning about our epidemiological modeling. When the first model was constructed, it was constructed for one segment of our customer base. We then replicated that pretty rapidly for other segments of our customers because the methodology was already in place. We brought new data in and we were able to create multiple forecasts for different segments. And that was quite efficient. Then as we shifted towards predicting individual risks, we had our clinical analysts, our data scientists, our marketing analysts all come together and work on both creating the models that identify individual risks and then figuring out how to deploy them effectively through the outreach. So for us, it's go fast, constantly learn, and then reuse the learning so we don't have to start it from scratch every time. And sharing the knowledge is paramount. So we do this kind of video calls a lot because it's the next thing to being able to be in the room and working together live.
Sounds like it's been quite a journey, and you have some very talented people working for you, and are lucky to be in that situation. We've had two questions from the audience here that have to do with going forward. How are you going to use the data, people who've been vaccinated, people who haven't? How are you going to use the vaccine data, and what do you think is going forward, the focus of the analytics to manage through the next phase of this?
So there's quite a lot of opportunity going forward. And I think every day I'm actually fortunate to work with such a tremendously talented and diverse group of people because the analytics that they bring together really give us an insight into what to anticipate. So, studying the vaccinations is definitely one area. And I mentioned that we created a COVID registry. We're extending the registry from just those who've been diagnosed to COVID to those who've been vaccinated, so we can create longitudinal panel and follow them over time to see what happens. In the registry, we're studying those who've had COVID, and we're finding out that 1 out of 3 of them roughly have other pre-existing chronic conditions. This is likely going to create other effects in terms of their health outcomes post-COVID. Our analysis shows that there are new diagnoses that are emerging now at higher rates, in particular heart inflammation, heart disease, mental health issues, nervous and respiratory system issues. These are all represented at significantly higher rates in post-COVID patients. What that tells us is that they're going to likely have other health issues, and we need to get in front of those to make sure that we're proactively engaging them in our various clinical management programs. We're helping them avoid a visit to ER. We're helping them avoid rehospitalizations through the different interventions that we can conduct either directly or through their healthcare provider. We're also looking post-COVID at segments of customers that may be impacted due to the deferral of regular and emergent care. What has happened during COVID, which is completely not COVID related, is that folks who may have needed their regular screening, such as cancer screenings, colonoscopies, mammograms, they've deferred those. And as a result, we've seen between 10 to 20% of such cancer screenings over the past year. We're also seeing reductions in cardiac care, stress tests, ER avoidance. Those are down significantly. We're also seeing more than 1 in 2 customers who have chronic health conditions such as diabetes or hypertension or asthma, delaying their preventative care visits. So, 1 out of 2 didn't have one in over a year. All this means that they are at higher risks of an adverse health event. They may, have a health issue that normally would have been diagnosed and addressed much earlier. So we're gearing up already as vaccinations progress to start identifying the segments of customers, start working with their doctors to get them back in for preventative care visits, and creating other types of outreach to customers who are most at risk so we can help them avoid these types of negative health outcomes and prevent some of these unfortunate events if we can.
That's quite comprehensive, quite a lot on your plate. We have 1 minute left here, and I wanted to kind of switch gears just a little bit to the personal side of things. You shared with our audience that your daughter got a PhD in operations research from MIT, which must make you incredibly proud as a mom. And you yourself have had quite an interesting career, starting in market research and consumer insights, and then going to consumer credit, and then being in the insurance world for a period of time. And now you're here right at the critical time in healthcare. What advice would you give to our audience of aspiring women here about, pursuing a career in data science, and from your own experience, both as a practitioner and as a mom?
Well, I've certainly watched my daughter take on the same or similar career path to mine, and it's been inspirational. She has had tremendous mentors at MIT, and she was fortunate to work with Professor Georgia Perakis, who's an amazing advisor and a female leader in the field. And I think it's about 2 things. One is do what you're passionate about. I've just been very lucky to be doing every day what I enjoy doing and where I think I actually do meaningful work. Pursue your passions, and 2, find the people who are like-minded people that you enjoy doing it with and that you would learn from. I've learned a great deal from each and every mentor and colleague that I've had the benefit of working with, and working with people you can learn from and who you respect and admire will enrich your professional life tremendously. Those would be my top 2.
Well, that's incredible, Gina. Thank you so much. You've inspired me over the 10 years or so that I've known you, and I'm sure you've been a big inspiration to our audience. And in fact, we've had a couple people write in and ask whether or not you're offering internships. So I will, you've obviously inspired our audience. So I will pass some of those along to you individually. But thank you so much for joining the WiDS community. We really, really appreciate your time. This has been terrific. So thank you.
Thank you, Lori. It's always great to be with you and really appreciate it.